Black people all over the world are suffering and dying too soon from illnesses that have plagued our communities for centuries. At Indigenous Health, we are on a mission to build the most valuable and genetically diverse data bank on the planet. Although people with African ancestry make up more than 20% of the global population, our genetic data is less than 3% of the data used in drug discovery. We are frustrated by the status quo and are determined to make a difference by becoming the change we want to see. We know you have lots of questions, and we're excited to answer those questions. You will also receive a free personalized health assessment. Join our community today at biusforall.com. Ooh. All right. All right. Well, thank you all for joining us. We're excited to be here to talk a little bit about Indigenous health. My name is Madia Logan, and I am the CMO for Indigenous Health, and I'm joined by Yusuf Henriquez, our CEO. And so we're just going to talk a little bit today about pediatric disease as our focus area. But first, I'm going to pass the ball to Yusuf to give his welcome, and thank you for joining. And then some of the company updates that are appropriate. Yusuf?
Good evening, everyone. Yusuf Enriquez, founder and CEO of Indigenous Health. Thank you for joining us on this Monday, December 20th. Looking forward to having some discussion of what I think is quite alarming numbers and statistics around pediatric cancer, how we could start looking to help treat some of these cancers at the younger stage and earlier stage at adolescence and infant, and looking forward to sharing some of our updates since we last tuned in last Monday. So company overview: Indigenous Health Group has been doing exceptionally well on the fundraising campaign to fuel this movement of increasing more diversity in clinical trials. Getting more membership engagement over the last month has been a huge increase. As far as fundraising, we've been able to close our first pre-seed round. We're now moving into the beginning of the year 2022 with quite the momentum that we were looking to start off with. And so also excited to talk about our technology, which is our web application for the personalized health risk assessment. Will be up and launched on December the 23rd, which is this week, so that we could start engaging our members that are already signed up and have some good insights on personalized health risk assessment based on surveys that will be provided to our members through the platform that have already signed up and that are looking to engage our platform. So super excited about that. Joined here by Dr. Wilson to have some meaningful discussions around what we could do to help with the infant mortality rate in the pediatric cancer area between the ages of from newborn up to 5-6 years old, which has shown a huge increase, not only just in other death areas but cancer. So without further ado, I wanted to share those updates with you guys, and we can start talking about some of the statistics that I know Madi is probably going to pull up so that we could dive into the conversation.
Yeah, definitely. Dr. Wilson, I'll just move to you really quickly to just any welcome comments before we jump into the topic.
Yeah, really quickly, glad to be here again on this Monday to do this Founders Live installment this week. Thanks for all those who are joining us today, and just look to continue to engage around these topics that are important to us, and to talk about them and discuss them, and talk about the things that we're doing to try to address them.
Yeah, great. Well, I just to get the conversation going, I had a few slides. Of course, you all are always welcome to ask questions. Please ask questions. If you do, that will steer some of our conversation. But just to get us going, I have a few slides in here. So first slide is just a couple of facts about children. So the first one is about Black newborns. Last week we talked about that. And when Black newborns are cared for by Black physicians, we see that they live more, that there's just a very clear statistic. And then the second one on misdiagnosing children with conduct disorders, Black children with conduct disorders, instead of their autism being diagnosed with autism. So just for these two factoids, was there any amplification or elaboration you'd like to give, Dr. Wilson?
Sure. I mean, I can, just touch on it. It's again, these are probably among the less known and less discussed health disparities that are out there, in terms of the discussions, the conversations that normally happen around these health disparities. However, they're not they're not any less important by any stretch. And it's just important to kind of underscore that there are things that we can do to potentially address some of them, right? That we can do now, and then there are additional things that we need to do. Right. So, and that it's important to address these health disparities on as many different levels as we can.
Yeah. Now, this was the summary that we shared with folks to get folks intrigued about the session. So we're talking about pediatric disease, but the broader topic, it feels like, is around health disparities. But this is health disparities focused on children, right? Children and adolescents. So how would you describe it to somebody who's completely new to like health disparities? When you talk about pediatric disease diagnosis, it just sounds like, for me, and I'm not an industry person, it sounds like two separate things. Like you're saying that the way that Black children are diagnosed with these illnesses, because of the influence that racism has on it, it's actually harming children. Is that accurate?
Yeah, that's a good way to kind of capture it in a nutshell. And when we talk about health disparities in general, we talk about differences in like the severity of a certain disease in one population versus another, when or occurrence or frequency of a disease in one population versus another, when other things are all other things being equal. So in terms of when you look at prostate cancer, for example, the rate of prostate cancer in African American males is significantly higher than that in their European or white counterparts. And then also Black or African American males are more likely to get a more severe form of prostate cancer, right? So these are a couple of disparities that exist there. And then similarly, we see disparities in breast cancer in African American women compared to white women, right? So those are types of things that we talk about when we talk about disparities in general. And then when we're talking about, like you said, diagnosis of pediatric diseases and illness, again, there are going to be multiple factors at play. Access to healthcare being one that, from the start, right? You know, how, you know, are Black children seeing their pediatricians regularly? Do they have, you know, regular wellness visits so that where these exams would happen and then some of these things would be picked up, right? So there's that level. But then there's a, you know, and you look at the next level, say, okay, if the children are being seen by doctors and they do are you know, getting this care, and then you see differences in when things are getting diagnosed, right? So that's another level of disparity that we can look at. So, and when we talk about that level of disparity, then we look at, you know, what's going on in the healthcare system and start to ask questions on what's going on there to try to identify the reasons that, you know, Black children are being diagnosed later.
Right. Right. Now, Yusuf, your daughters were diagnosed. You shared on biasforall.com. I don't want to say like I'm sharing something you haven't shared, but on the website, you shared about your daughter's diagnosis and that being a prompt for, you know, or one of the reasons you're so passionate about this work. Is there any with your experience being a parent walking through the diagnosis process of your children, was there anything, any kind of red flags, or what did you do to be proactive as a parent in that? And knowing that you work in industry is interesting too. So what was your experience like?
Yeah, you know, we normally do routine eye visit, which is probably something that's not done in our community, or the access to care, as Dr. Wilson just mentioned. And so, being that I worked for the government, I had better insurance than when I came here as an immigrant from Kingston, Jamaica. So I've been through the different level of healthcare system where you could see the difference, right? It started off in pretty much where most inner city and minority communities are left with urgent care and, you know, handling certain health issues at a moment's notice instead of the routine early detection, early prevention. So fortunately for me, you know, I was joined the military, and by the time that my daughters were diagnosed, we had already started you know, routine eye visit, and that's how their condition was identified. Do a routine eye visit in 2014, and when it was noticed, and we were then you know, scheduled out to see a expert. So it was noticed that there could be this particular diagnosis. However, the ophthalmologist at the time wasn't the subject matter expert, but was all able to allowed us an appointment to see NYU Eye and Ear, which is specialized in these type of diagnosis, and then we were able to follow up. So, you know, I compare it to the fact that, you know, being that we were, you know, in a community where, you know, I had started to and had the knowledge of, you know, doing routine eye care, we were able to identify my kids' genetic disorder early, and then be able to start doing some of the necessary, you know, steps. Fortunately, you know, my daughters suffer a double whammy just like you do, where they're Black and they're women, which are both lack in clinical trials. And so really there weren't a lot of option that provided some clinical treatment aspect for them. And the treatment that was currently available had some negative side effect on their reproductive health. And so that was also another decision I had to make. But, you know, again, not very much information that pertains to women of color and this particular disease area. So, you know, fortunately, because I'm in the industry and work in healthcare, I was able to do some of the, you know, natural remedy type disease management over the last, now they're 21 years old. So the last 7 years, where we've been able to stabilize, you know, their diagnosis from spreading to where they're going completely blind. So, so yeah, I think the experience of what I went through, I could just imagine if, you know, I was back to where I was an immigrant that just came here with not that level of care, right? I had the federal government plan that providing me decent health care where I was able to have my daughter see the best physicians in the country for their diagnosis. Unfortunately, the inner city and underserved populations don't get that. And, you know, those are where you see some of these illnesses that are really ravishing our community because we just don't have that level of health care available to us.
Got it. So, Dr. Wilson, interindigenous health. You know, what is the work? How is the work that we're doing contributing to health equity? Particularly, is there anything particular around this topic?
Sure. I mean, first and foremost is raising awareness, right? Doing what we're doing now, talking about it, right? That's the first and foremost thing we can do is raise awareness in our community about the importance, about you know, ways to be proactive in terms of health, right? And you know, the saying is very true, right? This old saying is the ounce of prevention is worth a pound of cure,
Right.
and it still holds true. So, and a lot of things that, you know, that our community is facing are preventable in some ways. So that's the first and foremost thing that we can do, that we are doing as a community, and you know, as African Americans, as representatives of various, you know, parts of the diaspora, right? We are taking the onus on ourselves to, you know, spread this message to you know, our community, and talk about this and raise awareness, and offer, you know, information that can, you know, educate people, right? That's the next thing in terms of what we can do as a company is education. So awareness and education, right, are where we start. And that's how we engage our communities about these issues and raise awareness, and people become informed, and they can start to, you know, do their own research, and, you know, talk to their clinicians about things, talk to their doctors, and then, you know, be proactive about their health, and you know, prioritize their health, and understand that, you know, health is the real wealth, right? So then there's that, and then next, as we move forward, the next step of it is doing the research, right? That's the next place that we get involved as a company, in terms of being involved in, you know, cutting edge research that, you know, leverages the latest technology, like next generation sequencing, and looking at genomics. You know, when we ask these questions about what are the drivers of these conditions and these diseases in our population, because we are genetically diverse, more genetically diverse than other populations, and it's important that we have representation in these types of research studies, so we can identify. Because often what we see is that when we're included, when research is diverse from a standpoint of who's involved, who the people who are involved in the research, there's often findings that are unique to populations like ours, right? And that often the findings that would have gone, you know, that wouldn't have been, you know, understood if those populations, if those research cohorts weren't diverse. So that's the next level in terms of importance, in terms of what we're doing as a company.
That's great. That's great. I wanted to ask a couple. So I have this this slide up, this inequitable care practices, and this was a part of what we shared as well, just to introduce the session. But did you want to talk a little bit more in detail, just to give folks a little more about inequitable care practices?
Right. So, you know, this is really the third area that we are trying to engage in terms of what we're doing as a company, and engage in our healthcare providers, you know, African American, Black and African American and Brown, and healthcare providers, clinicians of color, right? We want to engage that community as well, specifically for the reason, you know, that in some cases, what we see is that these health disparities can kind of get, you know, they kind of disappear. They kind of go away when the patient, you know, the clinician, the doctor looks like the patient, and then they have a better rapport, or whatever it is, you know, what's missing, you know, similar background, similar, you know, cultural understanding, you know, and just ways of communication, and trust, ultimately, right? Trust to really disclose the information that's going to be and trust what the clinician is saying. And ultimately, sometimes in outcomes can turn out better. And that's ultimately what we want for all of our folks. So that's the last part of it. How we connect. We're trying to connect our folks with Black clinicians, and we're working with organizations in different ways to do that and to really connect folks together, all for the ultimate goal of improving health and for our folks across the.
That reminds me of something Sharisa said. Sharisa Jackson. She was talking about her patients and how when she was in her military service, when she saw when there were Black patients, she felt like they would see her and feel like a sense of relief because they felt like she would, give them the truth or be clear with them about their treatment and what they needed to do. And so I remember her saying that it made such an image, such an impression, because I know how it is when I go to the hospital too, or when somebody's in crisis, they need medical attention and they see somebody that looks like them. There's a sense of real relief there. So that's great. Well, you guys are making it pretty easy today because we haven't gotten any questions in, but I'll just go to Yusuf. Anything you wanted to add on in terms of what the company is doing to specifically focus around, just to add on to what Dr. Wilson said about, is there any, or what else would you share about what we're doing?
Yeah, no, I mean, I think Dr. Wilson hit the nail on the head. I think that's a growing area that has a lot of impact, and given the fact that it's a network of clinicians and physicians that we can aggregate quite quickly. So that's one of the areas that we focused in on this personal health risk assessment was, once you, log on to biasforall.com, sign up and take it. One of our key areas of focus is, not only just looking at the disease management, but also looking at the clinical and research expertise that we have in our neighborhoods and in our community. And so, again, as replicated throughout the fabric of indigenous, we're making sure that we're not only just looking at, the end stage of some of these disease areas, but also making sure that we're doing that early detection, early prevention, and that health literacy piece that is so needed in our community. So, one of the efforts to expand on what Dr. Wilson has mentioned is, tapping into these huge Black clinician, physicians, researchers that look like us, right? To echo what you just said, what Sharisa mentioned, I was directly responsible for a 300% increase of veterans that joined clinical trials at the Bronx VA hospital in New York, just because I sat next to the director's office. My office was next to hers. And, again, minority and Hispanic veterans would stop by my office and just had questions. And, I think, what I was able to experience there was just being there and being a face and was actually part of the study. I wasn't in the IT department working on IT solution. One of the major questions. And so what I started to see was one vet would come sit down and understood, and I explained to him what the study did. And then, slowly but surely, word of mouth got down to the hallway. And, I would have another one or two other veterans just accidentally show up, but I know it was well intentioned for them to stop by because they had been given notice that, hey, there is a young African-American male researcher in the mental health department, that if you had some questions about the studies that you keep seeing on the wall that they're offering you to participate in, he's looked like a trustworthy individual and he looks like us. And so, that's the type of impact that Dr. Wilson is kind of alluding to. And so we're very intentional in making sure that we're going to aggregate probably one of the largest, network of clinicians and physicians, researchers, genetic counselors, because this is a huge, audacious goal. But these are the different areas that we're going to need our clinicians and our physicians to be able to, communicate with the communities that they serve.
Right.
And so, that may be a good segue to kind of add the fact that we've now also bringing on Dr. Gordon Taylor, who is an emergency room doctor,
Yeah.
and also a Howard alumni as well, as most of the folks here on Indigenous, who's going to be leading out our physician network initiative of getting more clinicians and physicians engaged in our Impact Advisory Board, and also membership as well, and being engaged to start looking at the different disease areas that we're going to start focusing on.
Great. Great. Well, thank you for that. With that, I want to invite everyone to sign up at biasforall.com. You just go to the website, you click the join us button. It takes exactly 2 minutes to fill out the form and to become a part of our community. So we're really excited about engaging you and talking to you more. We're live every Monday and doing a lot on our social platforms to engage folks. So with that, I will thank you for attending, and I'll pass the ball. Just open it up for any closing comments for Yusuf and Dr. Wilson before we close. Dr. Wilson?
Sure. I would just echo the sentiment, and echo and encourage the folks out there to really sign up. We have a lot of things in store. As Yusuf mentioned, we have our app that's gonna be released soon, and that's the first step towards what we want to do as a company in terms of engaging our community.
Yes.
Around these issues, and really starting that process of increasing awareness and education, and then move into further into doing the research, right, and actually understanding and identifying the drivers of these conditions from the molecular level, from the genetic level, right, and really start to answer some of these questions about these health disparities that we've been talking about for so long. And we're really looking forward and excited to actually doing something about it.
Great, thank you. Yusuf?
Yeah, I think in closing, I want to stress how important it is. I think this is a unique opportunity and time in our lifetime where, a lot of emphasis is being, shown on the COVID-related illnesses that have been very important for us to understand. I think, the numbers have shown how detrimental a pandemic was to our community. I think it has also, in my opinion, provided some level of light on the level from a political, even, from a health disparity standpoint of how lopsided care is. And so, again, I think, what we're trying to do is create an opportunity here for our community to come together, just like any other movement, to do something about their health care, because that's also another area where, structural racism and, the health disparity areas are affecting our community, not just, violence and other, police brutality. I think, what you'll see when you start taking the layer off, it's discreetly embedded in the way healthcare is delivered here in the U.S., of how it's been structured over years for minorities and Black and Brown Indigenous folks to receive kind of less care,
Right.
less attention is being brought to some of these things. And
Right.
you can look at it from a research level, you can look at it from a healthcare level, even from the provider level. And so, we're going to embolden our members to take that lead and that charge to get educated about their health, their specific disease areas.
Right.
So when they go armed to the doctor, they're not just waiting for them to give them information. They'll be armed with information already on the ready, so they can ask the important questions, because I think those are some of the things that we're missing, where we've just been able to sit and have things being told to you
Right.
as a clinician, the patient interaction. But I think what you're starting to see now is the world has kind of opened up where you're empowered with that information. You can have a better interaction with your clinician of what you want to personalize. And so I think the first step for us, which is, signing up for buyersforall.com and then getting that personalized health risk assessment, then starts that movement and drives you into what, again, our motto is driving precision health equity. So thank you guys for joining in. And I appreciate you guys spending some time with us today on Monday.
Yeah. All right. And with that, we will sign off. Thank you all for joining us, and we'll see you next week.
Thank you. Bye-bye.
Thanks, everyone. Take care.